Okay, welcome everybody to the Chaney et al. Video tutorial. So, this is all about asthma medication. It's all about encouraging children to take their asthma medication, and it's linked with Bandura. It's paired with Bandura in the developmental area of psychology, because the key theme is all about external influences on children's behaviour. So in Bandura's study, it's about that transmission of aggression, negative behaviours, whereas in the Chaney study, we're going to try and encourage children to take their asthma medication. Okay. So as I go through this, then pause and complete any associated tasks in your booklet, but also make sure you pause whenever you see this symbol and complete a summary of the different segments. Put this stuff in your own words, okay, and you'll remember it, whether it's a PowerPoint, a Prezi, audio recording, whatever it is, okay. I'm going to highlight things as we go, and you want to highlight as well, and then when you see the pause, you can look back at the words that you've highlighted and create your summary from those words. Okay. So off we go. The theoretical background. There is the Funhaler, okay. Looks like lots of fun. You can see the traditional asthma, that's known as a PMDI, a pressurized metered dose inhaler, stuck into the end of it, but then we've got some toys attached to it, and it makes lots of whizzing sounds. And the researchers are seeing if this designed piece of equipment is going to be better at making this young chap take the appropriate levels of medication, so taking enough of a puff, and also making sure that he takes it regularly as well, sticking to the dose. So the theoretical background to this, we're talking about conditioning. Now, operant conditioning is all to do with associative learning. The fact that we form connections and associations between stimuli and responses. Okay, on a simple level, it might be that you tidy your bedroom when you're little and you get a reward. You get some praise or you get some sweeties, and you are then reinforcing that operation. The adult is reinforcing the operation of making you tidy your room. So that's what we mean by stimulus and response. For dogs, it might be the word walkies, resulting in excitement of going for a walk, but it doesn't understand the word walk, but it does recognize the stimuli, the sound of walkies, and the response is it getting very excited. Okay, so operant conditioning is about learning through consequences, behavioural responses. So Thorndike was your key player in this, kicked off the theory of operant conditioning, and he came up with this law of effect. And the law of effect essentially means that if there is a desirable consequence to a behaviour, then that behaviour is going to be more likely. Whereas if there is an undesirable consequence to a behaviour, then that behaviour is less likely to be repeated. Okay? So if you get punished for something, you're less likely to do it again. If you get rewarded for something, you're more likely to do it again. So that is the law of effect. The effect that something has had on you will impact whether you are likely to do it again. Okay. And then this was developed by Barris Skinner, who developed that especially in animals, but applied those laws to human behaviour. So a couple of examples of that. For Thorndike, stimulus and response process, there you go. Positive outcomes are more likely, negative outcomes are less likely. For this cat, this is a Thorndike learning box, and he put cats in this box, and there's a little lever there. There was a fish, something desirable, outside of the box, and the cat would be in the box, want to get to the fish, and would accidentally end up pulling the lever and end up grabbing it with its claw, and the door would open. So the cat would get a positive outcome, and the cats would very quickly learn that pulling the lever would open the door, would release the door. So we're managing to modify this cat's behaviour because of the positive outcomes that we are providing. For Skinner developed this and did all kinds of things with pigeons, especially. Did it with all kinds of animals, but these are two pigeons playing ping pong, bashing the ping pong ball across the table to each other. I did that using this Thorndike box. He called it a Skinner box, and you get pigeons to do pretty much whatever you want them to. They can he got them riding unicycles, all kinds of things, by simply giving them some positive reward. So you give them a pellet of food every time they hit the ball correctly, or every time they return the ball correctly, they get a pellet of food. And so again, you can get elaborate behaviours as a result of all of these reinforcements. Okay, so now pause me and summarise that theoretical background, the Thorndike and the law of effect and Skinner. Okay, so moving on. The background of the study. So we've got 3 different inhalers that we're going to talk about in this study. And essentially this study is looking at whether this Funhaler can increase the amount of medication a child takes. This is your traditional inhaler, PMDI, stands for pressurized metered dose inhaler. So that's what most asthmatics will use. The spacer is a way to try and assist young children in taking the medication. It's sometimes easier for the children to use it, so that's known as the spacer. And then the Funhaler combines essentially the spacer with some more interactive elements, some fun toys and such like. Okay, so that's what you want to bear in mind as we go through the study. Essentially, the study is going to be comparing the use of these two and see which ones get the best outcomes, how we modify the behaviour of the children. If you link it back to Thorndike and Skinner, the law of effect, if you're a child who gets to see a big whizzing sound or hear a big whizzing sound and see toys moving around inside of the inhaler, then you're getting a more positive outcome to the desired behaviour, and the desired behaviour is using the inhaler. So our aim is to modify the behaviour of the children. So they're known as behaviour therapy and behaviour modification, and both are major approaches used by clinical psychologists and health practitioners to try and improve adherence to prescribed medical regimes. Okay, so improving adherence to prescribed medical regimes. Okay, they're also known as medical regimens, and yeah, so that's the kind of terminology that you want to take a note of. Prescribed medical regimes. That's the overall aim of this study, to try and increase the adherence to prescribed medical regimes. Poor adherence, so low dosage, so poor adherence to prescribed frequency, so how often you take it, and technique, so how to use the inhaler properly. Okay, so you shouldn't just very lightly inhale the chemicals. It should be a very deep breath, so that's when we're talking about technique. But the frequency is, do you do it every day or 3 times a day or whatever the dosage is? Remains a major problem for pediatric asthmatics on inhaled medication. So in other words, for children who are prescribed inhaled medication, it is a major problem of trying to get them to do it frequently and at the right level. Children don't find it fun taking this a couple of times a day. Rates of compliance for offering medication regularly to asthmatic children range from 30% to 70%, while paediatric compliance rates for the correct pressurized metered dose inhaler technique range from 39 to 69%. Okay, so getting the correct dose in, it's only 39 to 67%, and the compliance of actually regularly taking it is between 30 and 70%. So for some children, they're only taking this 3 in 10 times that they should be doing, and actually when they are taking it, they might not be getting the correct dosage anyway. And asthma's, a very serious condition, or can be a very serious condition. So you want children to take this medication. Adherence does not necessarily improve with rising severity of illness, and that's an important statement. Just because a child is getting more poorly with their asthma doesn't make them want to take it more. Okay, it doesn't make people stick to their medical regimes. Behaviour modification, to continue with that. So, although there's many reasons for poor adherence, Watt et al. Propose, so that is this Chaney and Watt. Watt et al. Proposed that positive interplay of adherence considerations, in other words, a positive interplay of trying to make them take the medication, and with the aerosol output factors like the correct dosage, would improve medication adherence in young asthmatics. They're also saying there that output factors, aerosol output factors such as making it fun. Okay, so trying to mix these things together, trying to get them to adhere to it, making it fun, getting them to take the correct dosage, trying to combine all those things would improve medical adherence. So the aim of this study was therefore to show that the use of a novel asthma spacer device, so novel means a new spacer device, the Funhaler, which incorporates incentivized toys in the main circuit and the main inspiratory circuit, whilst not compromising drug delivery, can provide positive reinforcement, which leads to improved adherence of young asthmatics. Okay, so you've got the toys within the main inspiratory circuit, which doesn't compromise drug delivery, and that can provide that law of effect, the positive reinforcement, the operant conditioning to improve whether young David here is going to take his medication. Okay, right, so moving on to the research methods. It's a field experiment, so it's because it's taking part in participants' home settings. This is actually, the parents taking the medication home, taking the Funhalers home and having a go at it. It's using a repeated measures design because the IVs were whether the child used a standard or small volume spacer device, which is known as a Breathatech, which looks like that. So that's the standard one that children would be given. And then they would also try, and this is why it's repeated measures, then they'd be given the Funhaler. And that's Infomed Limited. So that's the person who produced, the company that produced it. So they're going to use this spacer first, and then they're going to use the Funhaler. So that's your two conditions. Dependent variable, the amount of adherence to the prescribed medical regime. All right, so they're going to measure that from how often they take it and whether they're taking the right dose. The sample was 32 children, 10 male, 22 female, aged between 1.5 and 6 years old. So on average they're only 3.2 years old. The average duration of asthma that they'd had was 2.2 years, because some of them hadn't been alive that long, but yeah, 2.2 years on average, and prescribed drugs delivered by the PMDI and spacer were used. Okay. Children's parents provided informed consent and also participated in the study through completing questionnaires and taking part in a phone interview. So phone interviews, so it's all self-report really. It's an interview and it's a questionnaire, and they also helped where necessary in the use of the inhalers. So they were helping their kids to use the inhalers, which I would imagine would be more often than not unless you had an older child. Okay, so pause me and summarize everything so far, the research method and the sample in the background. And we'll deal with the next section, the procedure, in the second video. Okay, thanks everybody, see you there.